So we're going to go ahead and get started. We're so grateful today to have Dr. Paul Walker, who is Professor and Director of Medical Gross Anatomy and Neuroscience, with us today to talk anatomy and human body foundations. We're also super grateful to have Dr. LaTanya Riddle-Jones, Assistant Professor in Internal Medicine and Pediatrics. She's here to talk with us today about our population, patient, physician, and professionalism, P4, coursework and experiences. We're also lucky to have M1 reps from the class of 2027 Student Senate, Abby Shook and Raghav Rajesh, joining us for the Q&A portion of this webinar so they can provide a student experience for you and give you some tips as to what to expect as a Warrior MD. And for those of you who are more recently on the webinar today, please make sure if you have any questions throughout, we'll be sure to answer those questions at the end of all the kind of introductions and presentations today. But please be sure in the chat, you're clicking the chat with everyone option as you send us questions during this webinar so that everyone can see your messages. Once we hear from both Drs. Walker and Riddle-Jones and briefly from our student participants, will open it up for questions. So without further ado, Dr. Walker, would you help us get started with anatomy?
I'd be happy to do that. Welcome, everybody. Welcome to Wayne State School of Medicine. I'm really excited to talk to you today. It's a passion of mine to offer full cadaver dissection to the M1 students who come to the school. We have a very vigorous program. It's very exciting, rather unique because a lot of medical schools across the country have phased out their dissection programs. I'm going to share my screen and walk you through some of the things that you can expect during your first year of School of Medicine. And I can talk to you about a number of different things. Not only do I direct the anatomy program, but I'm the person that's in charge of your first 9 months of the M1 segment is what we call it. So I'd like to show you what that looks like because you might not know exactly. So this is, as soon as my full screen will go up, hopefully everyone can see this. This is a schematic diagram of your 4 years of medical training at the School of Medicine. And it starts up here with this darker green color. The first 9 months of the 4-year track is called segment 1. And segment 1 focuses on what is considered to be the healthy human patient, the healthy patient. In other words, the structure and function of the healthy human body. And we focus on that first to build a foundation that you will need as you segue into what is called segment 2. And that is the next 9 months of the pre-clerkship curriculum that focuses on disease. Now you'll see each of the months are represented at the top, and actually our courses that are offered within the 9-month period are divided into 3-month terms. So there are three-month terms, and each of the 3-month terms contains a course called Human Body Foundations. So that's a systems-based course. There are 3 parts to it, and it's designed to teach you as much as you can possibly learn about how the normal human body is put together and how it works, so that when you get to segment 2 and start learning about diseases, you have a solid foundation. Many diseases cause problems in multiple parts of the body, and it's good to know how they all interact. Now, speaking of interactions, an important part of our curriculum, and this occurs in both segment 1 and segment 2, is we immerse you into clinical training almost immediately. So we don't wait for you to get all the way through segment 1 and segment 2 until you start learning how to be a physician. And Dr. Riddle-Jones is going to talk to you today about how the P4 course begins to build that. And that occurs through segment 1 and segment 2. And we also have other courses as well, teaching you clinical skills and service learning, which is also something that is a strength of our medical school. In service learning, P4 and clinical skills are all integrated together to help you learn how to be a physician in the urban setting, and especially as related to the city of Detroit. So we are very immersed in that. Now, what this picture shows is the M1 segment in those 3 HBF courses in terms of their 3-month terms. And what I want to highlight here is that these are system-based courses. They involve individual disciplines that are foundational sciences. So you're going to get some very vigorous anatomical training. You'll learn microscopic anatomy. That's really important to set up your understanding of pathology. You'll learn how the human body develops from gestation to birth and beyond. You'll learn biochemical principles that you will use throughout your careers. And physiology, pharmacology mechanisms are introduced in year 1. We have a heavy teaching in neuroscience that's actually happening right now for our current M1 students, which we have 2 here today that can speak to that. And then we have longitudinal threads that are helping to teach the interpretation of medical imaging, help you to develop skills in understanding how research is done so you can participate in it, and also the principles of evidence-based medicine that you will use in your practice. And then important to our curriculum is integrated really throughout is we try to help you learn how to become a self-directed learner. And so we have 2 parts to this. We have a project called First Patient where you utilize the cadaver that you're assigned to investigate topics on your own. And we also have an exciting problem-based learning set of cases that you can practice your skills in clinical reasoning and problem solving. So when I say that this is systems-based, it is around the dissection of the cadaver. This is full body cadaver dissection. You'll be in the gross anatomy labs. You'll be teamed up with another set of a small group of students that will become your friends for life. This is what happens in anatomy lab. You develop friendships that really, truly last a lifetime. Our systems that are covered in the HBF course during the first term include musculoskeletal, peripheral nervous system, skin and vascular. And we have 10 anatomy labs in which we dissect the upper and lower extremities. And this is integrated with the rest of the disciplines that are part of the HBF course. We then transition into the cardiopulmonary, GI, and renal urinary systems and dissect the thorax and abdomen during that time. That's the second course for the second 3 months. And then we get to the final term in the M1 segment. And that's when we are finishing out with the reproductive endocrine system and the study of the central nervous system, including the brain. We recently had a very exciting dissection of the brain in which students participated in the removal of the brains from their cadaver. It was probably one of the most memorable events that they'll be experiencing in medical school. Now, I want to explain a little bit about how our dissection works in the lab because it's unique across the country. We feature something called dissection handoff, in which you work as a team, but you're split into Group A and Group B per team. So you have 6 members of a team. Group A, 3 members of that same team will perform a dissection on odd number labs. Group B receivers are not there during the dissection, but they come in after the dissection is done, and Group A provides peer-to-peer teaching and learning. So Group B receivers are able to learn the material. This fosters communication, teamwork across all members of the table. And then the next lab, which are the even number labs, 2, 4, 6, 8, and 10 for each of the courses, Group B becomes the dissector. And the handoff works in this circular way. So there's always something for each member to do. Everybody comes prepared, and you're able to use your time wisely for the dissection. This is what it looks like in the labs. This is just showing you a group of students at one table, one team of 6 students. They're performing some surface anatomy on their cadaver. A student is getting ready to make their first cut during the first day of lab. And we teach all groups at once how to dissect, and then they're split off into their various Group A and Group B. So you can see They're all pretty much concentrated on this. And gross anatomy is only one type of active learning session that we have in our curriculum. We have 11 types of active learning that occur. We have histology lab in which students work together looking at microscopic images and learning about histology. We have neuroscience lab that students today that you'll talk to just completed this morning. They had a neuroscience lab. They can talk to you about what goes on there. We have biochemistry team practice, case-based learning for physiology. We have a unique pharmacovigilance training where we teach pharmacology principles that are important for the use of drugs in patients. And the medical imaging training that we have is relatively unique to our school. We also provide small group sessions and the understanding of biostatistics and the application of evidence-based medicine. And then I said about our problem-based learning sessions that students basically tackle a case on their own with a faculty mentor that pretty much stays in the background and allows the students to utilize self-directed learning principles. So that's the part of my presentation that I wanted to share with you, and I would be happy to hand the presentation back to Kristen. I think you're muted, Kristen.
Thank you very much, Dr. Walker. We'll be sure to get some questions to you after the rest of the presentations here. Dr. Riddle-Jones, would you please help us shed some light on P4 for our webinar attendees?
Oh, absolutely. So while I am sharing my screen, I just will let you all know my training is in internal medicine and pediatrics. So I'm one of the clinical faculty at the School of Medicine, on which we have many clinical faculty. But I am actually at a retreat with my residents right now at Dave & Buster's. So if it is a little loud or you hear some music playing, that is what's going on. Okay. So again, you've heard the title of the course. We always call it P4. It's a lot shorter than saying population, patient, physician, professionalism. But that kind of encompasses what this course is about. And so why do we have this course? Well, really, why not? But it goes to this quote from Martin Luther King Jr. Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. And so really, this course kind of lays the foundation and then has you to kind of go a little bit deeper into that. And so I'll tell you more about that in a moment. Let me just change my screen so I can see my full screen. Okay, so P4 is a longitudinal course, which you just heard about from Dr. Walker. The course starts in year 1 or segment 1, continues into segment 2, and there's actually a little bit of follow-up in segment 4, which I'll tell you about towards that end. The course in year 1 is very different from the course in year 2, but in year 1, we really want to talk about, we're talking about behavioral health, social health, and we're looking at it in health system science context, okay? And so what does that mean? So the students will be able to learn to provide patient-centered and culturally responsive care to become effective team members when they're practicing. Well, and even as students, not just when you're out in practice after you've completed medical school. Students will also learn evidence-based frameworks of care that reduce healthcare disparities. Our students will learn to recognize their own professional development via professional identity formation that is throughout the course, but especially leading into the second segment and beyond. And you'll also learn to foster self-directed learning through use of the flipped classroom model, case studies, small group discussions, and interactions with community members that utilize groups of interprofessional people, okay? So it's not just medical students the entire time. We do have you engage with those in other healthcare professions and in the community, even law. We even have interactions with law students and law professors in the second segment, right? So at the end of the segment, you'll be able to describe the psychosocial cultural influences on health behaviors and outcomes, identify population health, social determinants of health, and policies that impact access to healthcare. You'll be able to apply those strategies to advocacy work. You'll learn how to, how your internal beliefs, your biases, which we all have, and your values actually inform your personal identity formation and how you are going to practice medicine. But ultimately, our goals are to teach you all ethics, biomedical ethics, but just all forms of ethics are presented in the P4 curriculum, and then taking the principles and the frameworks and applying them to real world situations through the cases, okay? Year 2 or segment 2 will continue all of the work that you did in segment 1, but we'll go a little bit deeper and we'll identify health disparities in patient populations and those who are underserved or historically marginalized. We will look at and examine patient community, what's going on at the patient level and the community level, what goes on at the physician and the health system level, and then ultimately what's going on the policy level, okay? And so you'll see the words micro, meso, and macro here. That's terminology that we'll go into deeper in the course. You'll learn more about it at that time, okay? Taking the same concepts, you'll develop effective strategies for eliminating health disparities through interventions at all of those levels. You'll be able to reflect on your beliefs, your biases, and your values, and just see how those change from segment 1 into segment 2. At the end of the second segment, each of the parts of the course, so there's part A, B, and C, usually we'll have a summative presentation. So this is a photograph from this year, some of the students giving their summative presentation. You'll see that they work in small groups. So there are 6 students in this group, and that's the same group that you'll work with in your anatomy lab, okay? So how do we go about teaching these things? What are the topics? This is what's really interesting to a lot of those who are facilitators in the small groups, which I'll talk to you more about that in a moment, but also the students. So unit 1, we actually have you all pre-read the book Medical Apartheid before you enter School of Medicine in July. And so this book just kind of talks about history in the United States, particularly history of medical experimentation on Black Americans from colonial times until present day. And so that really kind of stimulates your brains, and really we have an opportunity to be in a safer space with our small groups to discuss this history that you'll be shocked by some of those things if you haven't read that book yet, okay? Social determinants of health, communication, empathic listening, motivational interviewing, again, ethics comes up here, trauma-informed care, LGBTQ community and health, transgenerational trauma. We talk about that in year 1 as well, or segment 1. Internal experiences and physician impairment, structural racism. We have a module on the Holocaust and race-based medicine, medical errors, aging, delivering bad news, neuroethics, geriatrics. Okay, so there's a lot that is covered here. Really, it just scratches the surface. It's an introduction to these topics. And that's because we want you to apply them in segment 2, okay? And so how are we applying those topics? We're applying them to special populations. So the current contact for segment 2, we start off with professionalism and practice. We go into a unit on food insecurity, housing insecurity, but then we actually have veterans health. And so we bring in a panel of people who interact with the veterans healthcare system in the United States. We do the same with those living with disabilities, and we bring in a panel of not only community members, but those who are at different areas of care. So we may have physical therapists, speech pathologists. We may have people who work in prosthetics companies to come and show us the process of building the prosthetic, working with the families involved. And then, how is it covered? How do we cover it with health insurance? Okay. We also have a correctional health unit, which looks at the correctional health system, and we will compare and contrast that to systems of healthcare that are outside of correctional health. I'm really excited because we have some new content coming this year, starting in April with this course. We're going to take a deeper dive into health insurance, which includes Medicaid and Medicare. We will be introducing environmental justice and medicine into the curriculum at School of Medicine, which is really exciting. We have some community organizations that will come in and talk to us about the advocacy work that they are doing. And we also are introducing a unit on birthing persons and fetal health, which is something that students have been asking for, but also our obstetrics, gynecology, family medicine faculty members have also been asking us to dig a little deeper when it comes to these topics. So really excited about that. And I told you I was going to come back to talk about facilitators. The segment 1 course has small groups, but we have facilitators for every small group. those facilitators for segment 1, they are actually our faculty, whether they are faculty practicing solely at Wayne Health or in the Detroit Medical Center, the VA system. Some of them also are in private practice in the community. They are voluntary faculty. We actually go back into our alumni community and ask them to serve as faculty facilitators, and we have a robust response from our alumni when we go and actually make that ask of them. Now, in the photograph, you will see one of our coordinators, LaShonda, here, and you'll see our course director for segment 2, and you'll see a bunch of students standing around. And so these students are actually students in segment 4 of the curriculum, or 4th-year students. And so there's a required course that's called TLC. The students all are required to teach or facilitate at least one session of the P4 course for the 2nd-year students. But then we also have a group of students who are just really, really dedicated to teaching. And so this is an opportunity for them to actually do 6 teaching sessions or more with the small groups in the 2nd segment, or segment 2. Some of those students actually want to go into academic medicine. Some of them want to just do a better job of reflecting how what they learned in segments 1 and 2 of the curriculum in P4, how they applied those during segments 3 and 4. So it's really exciting, and students have given us positive feedback when it comes to having their peers actually come back and share experiences and facilitate those sessions. So what's the outcome? The outcome is a Warrior M.D. And this is the Warrior M.D. and I'm alumni from the School of Medicine. I just have to tell you all that once you get through this curriculum, I'm just so excited to work as a colleague with anyone who graduates from the School of Medicine. And it's because of how strong our curriculum is. It's because of the faculty and how we collaborate and, just incorporate ideas from students, changes in guidelines, and just put them into practice. So happy to take questions a little bit later, but thank you for listening to me.
Thank you so much, Dr. Riddle-Jones. Fantastic. Abby and Raghav, would you mind taking a moment now to introduce yourselves? Maybe tell us a little bit about where you're from, what brought you to Wayne State and Detroit, and a little bit about your experiences thus far in anatomy, P4, and at the School of Medicine in general. Abby, do you want to go first?
Sure. My name's Abby. I'm from Grand Rapids, Michigan. I knew I wanted Wayne State from the start, so there are plenty of things I can say about it. We'll get into a few once we start discussing anatomy in P4, but there was a really unique experience here in Detroit. I knew that was exactly what I wanted, being in an urban environment and being able to help the community in ways that you really don't get at other schools at all. So I knew Wayne State was for me. I wanted to stay in state too, so it was a great combination for me.
Hey everybody, my name's Raghav. I'm an M1 here at Wayne State. Basically, I went to undergrad in Dallas, Texas, but I'm originally from here, just 30 minutes south of Detroit, downriver Michigan. I think there's something unique about Wayne State where it's really involved with the community around it, like Detroit and Greater Detroit. And so you get a lot of unique opportunities in terms, like Abby was saying, in terms of interacting with the community, in terms of free clinics, and you get to really put to practice the things you learn in both P4 and anatomy. And also like Dr. Walker was saying, the anatomy program here at Wayne is pretty special in terms of the fact that you get to do live dissections with real cadavers that you don't get at many schools anymore. And even with when I hear about the dissection experiences at some other schools, I think that Wayne's is really involved. You get to like personally remove like the brain, and it's a really special moment that happened like just a couple weeks ago. And it's really cool, and like the friendships you build with the people in your group and everything, they're all really special. So I think Wayne is pretty unique in that regard.
Thanks. All right, I'm going to open up for questions right now at this time. Please note to everyone on the webinar that we also have Tasha Hogan, one of our admissions experts, in the chat as well. So feel free to ask her any kind of admissions related questions if you have any of those. But certainly we're hopeful to learn a lot more about anatomy and P4 and the student experience right now. So please feel free to ask any questions in the chat. While we're waiting for a few of those to populate, I have a few right now that I'm ready to ask. Dr. Walker, maybe you could tell us a little bit more about how anatomy groups are assigned and anything to do with any of the houses or anything at Wayne State.
Yeah, we start off with the housing list, and so that is provided to us, and we try to mix and match each cadaver table so there's as much diversity as possible at the table. And we spent a lot of time doing that. And for the other active learning sessions, you're not always paired with the same students at your table. We try to get you exposed to as many of your classmates as possible. So this is another thing that's unique. We have so many in-person sessions where the students are participating in practice of the material that they have learned through lectures. And our lectures are pre-recorded and offered asynchronously, so you can view them at any time. But we want you to come to our active learning sessions prepared, and you're teamed with all different types of students, so you'll get a lot of different exposure.
Okay, kind of a follow-up question to that, Dr. Walker. Why is full cadaver dissection so important in the educational process?
Yeah, so part of it is to be able to visualize structures that you yourself are dissecting and to see the enormous amount of variation that is common in humans. You're going to be seeing patients. Each patient is an individual, and you'll be shocked as to how much of that principle is reinforced in the gross anatomy lab, where you see all the variations that are within the normal range. And you also see your own classmates experiencing the same things, and you see how many variations there are in your classmates as well. So it's really a unique experience that helps you grow during the first segment of the school.
Abby or Ragav, you want to speak to that as a student at all?
Yeah, I mean, go ahead, Abby.
I was just gonna say, anatomy lab for me has been one of my favorite parts at Wayne so far. I absolutely love anatomy lab. I love my anatomy group, and it's a very great way. Like the number of times during exams where I'll think back to what I was looking at in anatomy lab in like a written exam, and it's like, oh yeah, I've seen this. I can visualize this. Like it really helps you learn in a way that you don't get if you can't like feel and hold the things that you're learning about. So I think it's extremely important in the learning process. But yeah, seeing the individual person, the individual cadaver that you're working with, and kind of like learning their life experience through dissection is really a great I would recommend you guys.
Ragav?
I mean, yeah, Abby's an excellent example. She's actually signed up to be a pro sector for next year, which is like their M2 students can kind of help prepare the cadavers for the incoming M1 students. And then when the M1s get to dissect, these pro sectors will come around and help answer questions. So it kind of is like longitudinal learning. Your dissection experience doesn't just end with your first year. You get to, if you choose to do so, you get to help M1s learn about it in your second year and even your fourth year. And I had another point, but I can't remember it. But basically, it's a really great experience. And the thing that Dr. Walker was saying about the variation, real life variation in different patients is super important. When we were doing like the renal system, for example, there was a couple patients that had like, you know, more than 2 kidneys, or, you know, they'll have like different formations on their kidney. We saw one cadaver, they had a kidney the size of a liver. It was insane. And so like getting to see that and experience it in real life is a really valuable experience. And I mean, you don't get that experience if you don't do live dissection. You're not going to get to see it until you see it in patients. And, you know, that's sometimes too late.
Dr. Riddle-Jones, I have a couple of questions in the chat for you. How is the P4 course different from the service learning course?
So very different courses, and the students can also speak to this from their experience. But the P4 course is really based in small groups and classrooms. We have a sprinkling of lectures, but very few lectures. And really, you're working with your peers to really understand what's being presented. It gives you a dialogue, as I said before, to have a safer conversation. But because of the diversity of those in your small groups, you're able to hear perspectives from, you know, various backgrounds when it comes to social economic status, education, diversity, just, you know, everyone's life experience informs who they become. And so in the small group, you get that opportunity to kind of share experiences and to kind of piece out some of these things, especially ethical dilemmas. You know, well, how should I be thinking about this? And how is that different than the way I thought about it before? So that's really the gist of the P4 course. Service learning actually is also, there's components that are a small group, but really that's getting you out into the community. So you actually have hours. I'm not going to try to quote them accurately because I am a little removed from the course, but you have mentoring and outreach hours. You also have clinical hours. And so some of those hours can be done in various settings, whether it be a free clinic or a street medicine run, or you could actually go and do some tutoring or just share the career of medicine and pathway with some students who may be from historically marginalized backgrounds, and just let them know, hey, you can be a doctor too. Talk to me. What are your questions? And so just really an opportunity to get to know the communities that you serve with the service learning course. I don't know if Abigail or Raj have more comments, but
Yeah, I can speak to about the service learning aspect a little bit more. Like Dr. Riddle Jones was saying, you get the opportunity to go out into the community and work with the community in terms of like various free clinics, volunteering opportunities. Basically, you'll have a couple required amount of hours each course, and they can be achieved in various different forms. So I think at Wayne, it's pretty unique that we have a lot of different types of free clinics for different subsets of populations of patients. And you can go and directly work in those clinics, work with patients, get on the ground. You know, you'll be taking histories, taking blood pressures and different things. And there's a wide variety of experiences. So it's not like every free clinic is the same. And also different organizations that deal with different things. We have like American Medical Women's Association. We have different interest groups for different specialties, and they all offer different opportunities. You can talk with attendings that are working in the real world and get all sorts of those valuable experiences and different ways to network with doctors and even clinics. And so that's a pretty important aspect of our curriculum too.
Thank you very much. Dr. Riddle Jones, one more question for you right now. Does Wayne State have course material to address disparities in diagnoses of neurological disorders and socioeconomic levels?
we actually do. So that's a very specific question. I had to think about it for a moment, but we actually do. In the first year course, there's a neuroethics actual module where Dr. Markowitz, who's our course director for the Segment 1 course, digs into that. And so really all of our curriculum, we are looking at diagnosis, but then how are things diagnosed different based on social determinants of health? And so that's where the healthcare, the disparities comes into play. Now, we also are fortunate to have students who are just so involved in the curriculum. And so we have a curriculum management committee, which is mostly faculty, but does have student involvement. But we also have a subcommittee. The subcommittee looks at social justice in our curriculum. And there's actually students who will go through and do an inventory of our curriculum to make sure that we are doing the best that we can to make sure we're addressing healthcare when it comes to all populations, including socioeconomic levels. So that is a work in progress. The first year segment for, human HBF course has actually been reviewed, and there have been changes made to the curriculum. We're actively making changes to other areas, and we're going to make sure that we have a process to continually do that review of the curriculum. But yes, the answer is yes.
Very good. Good to know. Kind of from a generalized student perspective, wondering if Abby and Raghav, you can talk a little bit about how you've managed your work-life balance as an M1 student.
Go ahead, Abby. You can go first. I've been answering a lot of questions.
All right, I was gonna say Raghav and I are both pretty involved in a few different things at Wayne. So we're both on the curriculum committee, which figuring out how to balance that is a job on its own since it is pretty involved. But we're also involved in student clinics. So I'm involved in a clinic that's actually starting right now called the Returning Citizens Clinic, where we're helping people who have been recently incarcerated with getting medical care and just figuring out exactly what they need upon release. So that's another thing that starting a clinic is definitely a heavy workload, but figuring out how to balance that with classes and curriculum committee and all of that, while it's difficult, it's very achievable. Like, you don't be worried about taking on a lot of tasks, because when you go to like active learning sessions and things like that, it really helps solidify what you're learning in lectures anyway. So even though your schedule might be busy, it's very achievable. So
I think the curriculum also does a pretty good job of gradually transitioning you into like the workload. A common term they use is it's like drinking from a fire hose. So when you start, it's gonna be pretty hectic. You're gonna get a lot of information all at once that it isn't at the pace that you might be used to. And so the faculty and the curriculum directors understand that that's a difficult transition. And so when you first start here, they'll kind of slowly work their way up to that workload and get you to a point where you can manage it. And as far as extracurriculars are concerned, like Abby said, me and her are pretty involved in a lot of different things. While I'm not involved in any free clinics like on the executive board, I am involved in like a lot of different things like research and stuff like that. And so that can be pretty time consuming. But a lot of these organizations know that when you first come in, there's going to be a lot of things that are being thrown at you at once. And so they usually wait till you kind of are a little bit settled into the base level in terms of curriculum and your classes and stuff like that. And then they start introducing you to organizations. And so everyone is pretty, they're all looking out for you and making sure that your transition is smooth and as stress-free as possible. We're not going to say that it's going to be completely stress-free. There's going to be some stress, but it's managed well. And there's always resources for everyone if you are struggling. So everyone here is looking out for you and your best interests.
I'm gonna circle back briefly to Dr. Walker and Dr. Riddle-Jones on a couple of things. Again, kind of going back to the cadaver aspect of the curriculum. Dr. Walker, can you talk a little bit more about the philosophy of the cadaver as the student's first patient and speak a little bit about the process and the interaction of the families at Wayne State?
Yeah. Well, it's commonly thought that the cadaver is the student's first patient. It's the first time that students are introduced to a human being that likely has pathology. And our cadaver program is a huge program. We interact directly with the families of our donors. Every cadaver that comes to Wayne State is either willed directly or willed by the family. And our first day of lab is an opportunity for students to actually receive a message from the families of the cadavers. There are letters that are read about the cadavers themselves, written by family members. And we read these letters to give the students an understanding of the humanity of the practice of dissection, and that it puts a level of respect with the students that otherwise might not be there. So they're introduced to that right away. Now that first patient mentality is kind of reinforced throughout the M1 segment through the first patient project, where we use the cadaver as a centerpiece for students to explore topics that they might be interested in. And one of the first topics we actually put on their plate is the social determinants of health and how it might have affected their cadaver during their life. So we give them the zip code of their cadaver, and they go off and they investigate how the social determinants of health in the cadaver's community might have affected their own health. And then after that, they continue their learning process by just investigating something on their own about a disease or an observation in their cadaver, and they build that topic out to something that is their own. And the faculty are there to provide some feedback to them on that project. So the first patient is with them from the beginning and with them at the end of the segment, and that culminates in a memorial service that we have for the cadavers. And it's a very moving experience for the students, well attended by the families. It's an unforgettable experience. And so from start to finish is the cadaver as the centerpiece.
Dr. Riddle-Jones, I know I continuously read about things that you're doing above and beyond your other positions that you have. I know that we've recently read that you're heading up a new task force that's seeking to end racialized differences in medical education and practice. Can you talk a little bit more about how the School of Medicine, you in particular, and others are working to eliminate health disparities?
So yes, definitely. I could talk on that all day, but I won't. But really just the So I am a graduate of Wayne State School of Medicine. I am passionate about the community that we serve and just making sure that we're doing what we need to do for that community. And so in recent years, learning more about the history of medicine, we realized that there are some practices that are just old and we just repeat them, but we don't know where the practices came from. So in learning more about the history of medicine and how some of these things like the algorithm to calculate a kidney function test is called the EGFR. So it looks at the glomerular filtration rate of the kidneys, and it kind of tells you about the kidney's function. We realize that there are some coefficients that are added for race, but that is from nothing. So, you know, why are we changing this EGFR value for someone based on their skin color, based on their phenotype, something that is not actually inherently in the genes? And so just learning more about that, we realized that we're delaying some of our patients from getting to renal transplant when they could qualify sooner if we just took that variable out of the coefficient and out of the algorithm. And so this is true of pulmonary function testing. This is true of an old calculator, which I'm happy to say we're not using any longer, called the VBAC calculator. The VBAC calculator, if a birthing person had a cesarean section with their first delivery, then there was a calculation we made to see if it was safe for them to actually try to have a vaginal delivery with the second. But that also took into account race, and no one really knew why until we started looking back at the history of medicine. So this task force is made up of representation from not only School of Medicine faculty and support from our dean, but also main campus, our provost and our president. I will say the Detroit Medical Center, Wayne Health, Karmanos Cancer Institute, along with, now here comes the policy part, we have lawmakers from the state of Michigan who also support the work that we're doing, and from the city of Detroit. And so that this is not just something that's happening locally. This is a movement that is actually international. And so we are happy to kind of lead the way here at Wayne State University, with students also involved in that. So I think you kind of hear that theme today. Students are involved in every aspect of what we do here at Wayne State, and that just really makes it very unique. But yeah, so thank you for that question.
Definitely. Thank you for the answer. From a student in the chat, does Wayne offer the opportunity to take courses such as anatomy and P4 in an abroad setting in Europe or Asia, for instance, or would this require taking additional time separate from the four-year coursework?
That's a hard question to answer. I haven't had a student ask whether they can take anatomy abroad, so we don't have any specific mechanism for that. I think if a student did take time off, leave of absence to go study at another institute, that would require additional time, such as a year off. Dr. Riddle-Jones, I don't know if you know any.
No, so I will say that there are definitely opportunities to do or participate in work abroad, but not built into the time when we need you dedicated here. And especially the P4 course, it is small group based. So we actually need you in person for the small group sessions. So, and I think that's what makes this curriculum just so great, is just being and working with those who are here. So yes, I agree with you, Dr. Walker, but there's definitely opportunities to do some global health work.
I'm going to end with two questions. The first one for our professors. Is there anything else about the unique nature of our curriculum that you think these prospective students, admitted students, should know about?
Anything else? Well, we talked about the interactions between the students, you know, in their learning of the material, and the many active learning sessions that provide practice. One of the things that maybe sets us apart, in addition to the information that Dr. Riddle-Jones had said, is that we provide, we're not a commuter school. You're not going to be lost out in the ether atmosphere without any interactions with your peers. We want you here. We want you in person. I think we're probably one of the schools that can tout that you're going to get dirty when you come here. We're gonna train you You're going to be the first one to volunteer when you're a resident. You're going to be the last one to leave the bedside of the patient. That's what we train here. And when the phrase Warrior MD is used, we really mean it. And I think that really sets us apart.
And I echo everything that you just said. I think that the numbers may look intimidating. Yes, we are a large school, but there are so many small group sessions and opportunities to be with your colleagues that you won't get lost. And if you feel like you're getting lost, there's so much support here. Just ask someone. And the thing that I'm learning more about is that there's a mentoring program between the first and the second years. And so it's not optional. You actually are matched with someone. So it's a big university, a lot of students, but really you won't get lost here.
Thank you both. Okay, final question for our students. Is there anything else that you think our future Warrior MDs on this webinar should know that we didn't ask in this chat today?
They kind of addressed this question a little bit earlier too, with sometimes there's concerns about the large class size at Wayne, but I will say, like, coming in, it was kind of daunting for me too to see like a class size of 300, which is like almost double what a lot of other schools have. But the administrators do a great job of making sure you get to mix and mingle with a lot of different groups of people. Like Dr. Walker was saying, you have your anatomy group, which is like a group of 6 people. And you see them in a lot of different scenarios, but you also see a lot of different people from a lot of other like areas too. Wayne does this thing called the house system. So if like you guys are familiar with like Harry Potter, there's like the different houses and stuff. We have something kind of similar here at Wayne where it's like there's different colors like red, blue, green, gray, yellow, bunch of different colors like that. And so the students are kind of grouped into these different houses. And the first thing you do after orientation week is you kind of have like this house Olympics. And so a bunch of people show up and you get down and dirty, you get to do a lot of different events and activities, and there's like a winner, and so my house, Gray House, obviously we're the best. We won the last cup, but people get really into that type of thing, and you're not going to be just stuck with the people in your house. You'll talk to people from different houses, and those groups come up a lot of different times, and they'll do lots of different social events and things of that nature. And so you'll get to see a lot of different people, even if you don't interact with them a lot. You'll know a lot of different people on a first name basis. I'll be walking through the hall and I'll see like 10, 20 different people that I know, and I'll be saying, hey, hi, what's up? And I'll be asking them how their day went and stuff. So it's definitely a very big community here, but it's a very intimate community as well. And you really will feel that if you come here. Everyone's very inviting and open.
I completely echo what Raghav said. And I think it was just funny how you mentioned the Olympics, because I was thinking back to how few people we knew right at the start of school. Now you see the exact same Orange House and it's like everybody knows everybody. Everybody's so close. Everybody wants to hang out and go to the DIA and like do all of these things together. So you really become so close with a huge group of people. And it's a great community that we have here.
Thank you so much. That concludes our Q&A portion of this webinar, and I want to be sure to thank all of our presenters and participants today, Drs. Walker, Dr. Riddle-Jones, Raghav, and Abigail, and I'm so sorry I keep saying your name absolutely not correct. Raghav. So my apologies on that, but I wanted to thank you all so much for attending. Your participation is so appreciated. If we did miss any chat questions, please know you can send those to mdadmissions@wayne.edu, and we are happy to get back with you. Please don't forget to bookmark our Warrior MD checklist online for our admitted students. We're going to continuously update that with new event information and new deadline information and so on there. So thanks so much again for joining us. We look forward to seeing you at future events and on campus, hopefully as the year gets started. So thanks again and have a wonderful weekend.